I'm here at the annual meeting of the North American Menopause Society, and I am talking with your name,
Maria Sophocles.
Dr. Sophocles, and you are?
I'm a board-certified OBGYN with a private practice in Princeton, New Jersey.
All right. And we were discussing yesterday about her. She has a number of interests that she's involved with, but one that we think is important for you to know about is the area of lipids, meaning cholesterol particles in your blood and your heart. So tell us a little bit about that. What should women worry about or think about or be aware of?
Right. So cardiovascular disease is the number one killer of women in America. There's an enormous amount of fear among women, especially in their menopausal and geriatric years, of breast cancer. There's a tremendous fear and a lot of media and medical attention on diagnosis and treatment of breast cancer. But if you look at the numbers, cardiovascular disease is by far the number one killer in America.
So you may worry about your breast, which you should, but you may in fact be more susceptible to heart disease.
True, and it's a silent killer, unfortunately, and it's a process, and I'm talking about the process of atherosclerosis and atherothrombosis that begins far before we ever worry about it. I'm talking about a process that can begin in our 20s, in our 30s, in our 40s, and it's accelerated by preventable things.
So people can have heart disease, and it may ultimately be the thing that kills them when they're 60 or 70 or 80.
Right.
But the problem actually begins in your blood vessels in your 20s and 30s.
It does. And the decision that our blood vessels make as to whether to get clogged and clotted or not is not always one we even have control over. We can control diet, we can control our weight, we can decide whether to smoke or to eat healthy, but there's also genetic factors that we may not even be aware of. So I think it's very important for physicians, even OBGYN physicians, not just cardiologists, to ask women about their family history.
Since this is aimed primarily at women and the patient side of things, would you say that patients should be asking about what their cholesterol levels are? What should they?
Yes.
What blood tests should they get?
I think they should know, just like we know, most of us know our social security number. I think we should know what our baseline cholesterol is, and we all have heard the terms good and bad cholesterol, and that's still an oldie but a goodie. You should be aware of what is your total cholesterol, and do you have elevations in bad cholesterol? Do you have...
Now that's a good thing. If your good cholesterol is high, that's not a bad thing.
That's a good thing. If your bad cholesterol is high, and I'm talking about something called LDL, that is a predictor of cardiovascular disease. And so you might be thin and non-smoking, but if you have high LDL, that's an independent risk factor for early heart disease, stroke, and heart attack. The other thing I think you really should always make sure your doctor knows is your family history. If you had a brother who had a heart attack at 54, don't consider it a fluke. Consider it part of your genetic risk profile.
So family history, whether or not you smoke, your blood pressure, and the good and bad cholesterols, those are things every person should know about herself.
Yes, and I think it's never too early to understand that. I myself have something called familial hyperlipidemia, and that's a disease whereby there are genetic risk factors for heart disease. The receptors in the liver do not work as well, or there are not as many of them. This is much more common than we previously thought. 1 in 250 people have this.
And the liver is the site where some of this cholesterol is actually produced.
Right. But cholesterol is also in our bowel, and there are even medications we can take that don't even go into the bloodstream and bind this cholesterol and remove it. So there are super safe ways to reduce cholesterol without even taking medications that go into the bloodstream. But I think before you can worry about whether you need medications, you and your doctor have to have a mutual knowledge of whether you have risk factors and what are they, and what is your cholesterol. And I don't think it's ever too early to know that.
Know your numbers.
Right, and know your risk factors. Many women think that just because their cholesterol is normal, they can't possibly be at risk. But we know that increasing waist circumference is its own risk factor. If you have in peri and postmenopause, women's bodies change and they become more, we go from sort of a more curvy shape to a more centrally obese shape.
Pears to apples.
Pears to apples. If this is you, and if it is, you're a very common woman in America, we know that there is an increase in what we call visceral adipose tissue, and that is its own risk factor. So you have to know what they are, and if you don't know, you should talk to your doctor about it.
Thank you very much.
You're welcome.